Good evening, ladies and gentlemen. Welcome to our Sierra Cast TV discussion. This is your host, Leroy Wilfred Kabs-kanu. Today, we have with us members of an organization called MINA. They have some impressive plans to help boost the healthcare delivery system in Sierra Leone. We're going to talk to many members of the organization who are here with us this evening. We're going to start with the president of the organization, Mrs. Gray.
My name is Mrs. Isata Gray. I am married to my lovely husband with 3 beautiful kids. I started my nursing career in Freetown, Sierra Leone at the National School of Nursing. I graduated in 2001 and relocated to the United States the same year. I received my registered nurse license in 2002 and I practiced in different settings like acute, subacute, long-term. And currently I'm working at a psychiatric hospital. I've been there for a couple of years, and in 2014 I decided to further my education, which I graduated in 2015 with a bachelor in nursing. And currently I'm pursuing my master's degree in nursing. It's a pleasure having you here.
Thank you very much for introducing yourself, Mrs. Now, what is MINA? What are the goals and objectives of the organization?
MINA for short is Massive International Nurses Association. It's a non-profit, charitable-based community organization here in New Jersey. Our organization is comprised of professional nurses who are members of the Light of Christ International Fellowship Ministry. MINA's sole objective is to provide quality health awareness seminars and health educational services to residents of New Jersey, with a plan to extend the services globally, especially to our native land, Sierra Leone. MINA believes that these initiatives will be done through collaborative community support, blood pressure screening, community work, hosting healthcare services, and educational seminars, while working with collaboration with the Light of Christ International Fellowship Ministry and other organizations.
Okay, thank you very much for giving us the goals and objectives of the organization. We have with us here also another member of the organization, Madam Agatha Dembi. Can you introduce yourself? Now we have 2 more members of the organization here. On my right hand side is Mrs. Kumba Zamora.
Thank you. Hi, my name is Kumba Safi Samura. I'm the First Lady of the Light of Christ International Fellowship Ministries. I'm the Director of MINA. I'm married to a lovely husband, Evangelist Dr. Kole Kelly Samura, who is the founder of TLOCI. I graduated as a registered nurse at the National School of Nursing in Freetown. I'm a set 28 in 2001. I'm presently working at FMC, a dialysis clinic in South Plainfield, as a registered nurse. Thanks for having me here.
Okay, thank you for introducing yourself, Mrs. Samura. I learned that you are living for Freetown, Sierra Leone. What is MINA planning to do in Sierra Leone?
Thank you. Well, there is a phrase, I think it was JF Kennedy that said that phrase. Like so many times, people will be asking, what is the country doing for us? But it is about time that we ask ourselves, what are we doing for the country? I remember a couple of years ago when we went to Sierra Leone on a mission trip, we met somebody in Freetown one of the rich people. And they were saying, what are you guys doing here? We said, we came to help. We want to give out. And they said, so many people need help in Sierra Leone. It's almost everybody need help in Sierra Leone. We say, you know what? The fact is we can help everybody. But what are we going to do about it? Are we going to wait until we'll be able to help everybody? At least we believe if we can help one person, it will make a great difference. So this organization, our organization, MINA, we have decided to give back to our country. I know in the future we'll give back in other countries, but for now, we are just limited because this organization was just formed like a year to 2. So we have decided to go this December, most of the members of MINA, to give out, especially to the children. Now we can do the old hospital, but our plan this December is to go to Freetown and take care of one of the ward, which is the surgical ward for the children, just do some painting, and then we mount some TVs.
What hospital is that?
This hospital is the government hospital. It's the government hospital.
Connaught
Hospital, yeah. Yeah. We're gonna do some painting, we're gonna mount TVs, for the children. Children are very, very precious. So we believe that when we reach the children, we can reach the father and we can reach the mother. But for a start, we have to do something. We're not gonna wait for the old hospital to renovate the old hospital. So we wanna start first with the children's ward, when we do that, and then we'll take it from there. But that's our plan. And if I may say, like a couple years ago, when we went to Freetown, by then MINA was not formed. We took some wheelchairs, we took some gloves, we took a lot of medical supplies, but MINA was not formed. We gave to Connaught Hospital, we gave to the police hospital, but now that MINA is formed, we are in it and we know what are the needs of the people out there in the medical field. I think it's a good thing. That's why we are going to Freetown this December, to start up something. We believe in a small beginning. We know when we do it small, definitely we will go big.
Okay, thank you very much, Mrs. Samora, First Lady of Light of Christ International Ministry. That's a lofty goal that you have, because if other organizations in the US decide to do the same thing that you are doing, however little, you will help to make a great nation. So thank you very much for the plan. Ebola just ended in Sierra Leone, and we are having a post-recovery program. Do you plan to contribute to that too?
Yeah, well, just as I was saying, I remember when Ebola broke in Sierra Leone, and my husband, there was so much fear, because of the killing, the dying that the children, everybody, a lot of people were dying. My husband went there, just to encourage the people and give people hope. Not just only doing that, but giving people, like, giving them something like, food, gave them like money, just for them, because it was very hard. It was not easy for people, to do. A lot of people, let me say 90% of the people, or maybe 70% of the people in Sierra Leone, engage in business. But because of the Ebola, people were so scared. It was so scary that people were limited at home. Post-Ebola, we were praying for Ebola to be over. And by the grace of God, we want to thank God if Ebola is behind us. But we have a lot of work to do post-Ebola. We realized from the experience that we had that so many people die because of lack of education. Because, and you know what, we can understand. Because I won't see my mother dying, to touch my mother, it's a problem. But if the people have the education, you know, and they have all this protective gears, you know, to prevent them from getting the disease, you know, like a contact prevention, you know, infection control. So our plans are not just only praying. That's why we go there every year. By the grace of God, MINA is going. This is the first year that we are going. But the Light of Christ, you know, the church, we always go there every year. We go and we just don't send it. We go there, we make sure we give the right people. So, but this time, this is our first project that we are doing. And, you know, it's not being sponsored by any organization, nothing, absolutely. It's being sponsored from our pocket. You know, we want to give out. God has blessed us in this country, so we want to give out to people out there. So our plans for post-Ebola is to teach people, you know, we are working on it, to go out there, you know, and educate people. It's not only about Ebola, like we said, you know, being in the nursing field, you always take everybody as an infectious somebody. That's why, you know, your precaution should be like, it doesn't matter if even you don't know the patient, you don't know the person. You just take it like that person is very infectious. So if the people are educated, you know, by us that know better, you know, how to behave and or how to prevent themselves from infection control, you know, I think so many lives would have been, you know, prevented. So our post-Ebola is to go out there, you know, whoever we can speak to, people that are on the ground there, you know, we'll talk together, you know, sensitize people, you know, teach people. So in case something like that ever occur again, we won't say people won't die, but we'll try our level best, you know, to minimize the amount of people that died during this Ebola time. So that's our goal, you know, to go out there, sensitize people, you know. We not only that, we give out to people, you know, because most of the time you just can't go out there and just start talking to people. You have to attract them with something, whatever we can attract them with, you know, for them to come and listen to us. That's our plan, post-Ebola. And once we've started this, just like I said, you know, all these things that we are doing this December, we want to believe the next time when we go there, we'll go big, by the grace of God. Thank you.
Definitely, it's good to have such a high ambition, you know, especially when you are talking about our country, how to help in the healthcare delivery system. Thank you very much, Mrs. Kabs-kanu. On my left-hand side, I have Mrs. Makale Bangura. Now, after what you would have achieved in Sierra Leone, how do you plan to apply your experience to the community that you live here in New Jersey?
Thank you. I'm Mrs. Makale Bangura, a mother of 3 precious kids. I relocated to America and went to a nursing school here. And for the past 3 years, I've been practicing as a nurse, working in a long-term facility. We have plans for Sierra Leone. When we go, as per what we're going to do, and that will enlighten us and that will give us more ideas as per what step we have to take next. Because that's why we made it an opportunity for a whole lot of us to go. So we could see it ourselves, we could meet with the people and know from the people. Because it's better you go yourself, you see it reality, you see your, you know, you have an idea of really what the needs, not just from hearing, because we have a lot of news coming in, the people need this, the people need that. But when we go, we see the situation, then we could assess. When we come back, we know then we can start prioritizing the situation, which one we should attack first. Because the needs are varies, because needs comes in priorities. you know. So when we come back after going, then we can know the one that is priority. We can know how to treat the people, the areas that they need the help, you know, and then we can know how to come into work towards and go back and see. But we're working hard towards, we're not just stopping here. We have to take MINA not just in Sierra Leone, not just to the city, but to the provinces and to even other countries. So MINA has a great plan. We have a great plan in terms of help.
Thank you very much, Bangura. On my left-hand side is Mr. Philip Sami Conte. He's also a member of MINA. Can you introduce yourself?
Hello, ladies and gentlemen. My name is Philip Sami Conte, and I'm a licensed practical nurse. I am the Secretary General for the MINA, which is Mass International Nurses Association, and we basically are located in the United States of America and trying to work back in Africa. Actually, for now we're limited to Sierra Leone, but in the future we're looking forward to establishing another part of the world. Thank you.
Yeah, very good. So with these kinds of plans that you have, which are very impressive, and I'm sure that viewers will agree with me that with the kinds of problems that we have in our country, having such an organization like MINA will go a long way to help in the healthcare delivery system of the country. Now, in this community that you live in, will definitely be interested in what we are doing. So how can the community help you to accomplish your goals, and then how can they contact you?
The MINA is a non-profit organization based in the United States of America in New Jersey. And we're working in collaboration with the Light of Christ International Fellowship Ministries here in the United States. And so, if you want to be a part of this team, you want to be a part of this organization, there are channels you could reach us through. We have a website that we have a link from the church website, www.tloci.net. And also the church also has a Facebook page where you could reach us. And there are pictures of what we've been doing back in Africa that you could see, you could reach, and you'll be able to see what's going on. So we are looking forward to donors. We are looking forward to people to help. It could be in kind, it could be in deed. No matter what, $1, whatever it is, would be appreciated. Any kind, anything will be appreciated. We need crutches, we need wheelchairs, gloves, beds, books, linens. Monetary donations will all be appreciated also. And there are numbers you could reach us to. The president for MINA is Mrs. Isata Gray. Her number is 201-693-7798. I'll go over it again, 201-693-7798. And my number as a secretary is 732-640-6439. And also the number of the CEO, so the director of MINA, Sister Mrs. Samura, is 732-322-6228. So once more, there are a lot of ways you could be a part of this mission. There are a lot of ways you could be a part of this endeavor. So let's all come on board and let's see what we can do to help back our people back in Africa. And we are not limited to Africa. In the long term, we are looking forward to establishing in every part of the world. So, as a start, let's just see what we can do to help people back in Africa. And for those of you who know, 3 countries like Liberia, Guinea, and Sierra Leone were affected most after the Ebola. So, there is a lot that is needed back in Africa. So please, come on board and let's be part of this work. Thank you.
Okay, thank you very much, Mr. Philip Sami Conte. As we can see, nursing definitely is a very important profession, and you are using your profession well to benefit the society. Now, in the light of that, do you have any message for the community in terms of what they can do to boost nursing?
Yeah, well, like I said before, and I'm saying it again, I see nursing as a way of life. It's what you do in school when you go to nursing school, okay, it's good. But if you're a different person when it comes to being a nurse, then it's gonna affect you a lot, because it takes compassion, it takes affection, it takes empathy to be a nurse. So if you're out there, you don't have to go to school and be a nurse. You don't have to be a graduate to be a nurse. You could be a nurse by showing empathy, by showing love to those that need love, by being there for someone that wants you to be there for them. So everyone in the community could be a nurse in one way or the other. So let's all come on board and let's put our hands on deck and see how best we could help and help things out, so people will be able to understand what's going on basically in the organization, as we say. Yeah.
Okay, thank you very much. My last question for you is, given the importance of nursing, as you have said, and given the need that our country has for nurses, do you see many Sierra Leoneans getting involved in medical fields?
That's a beautiful question. Like, first, some years back, okay, it was kind of like a stereotypical way of looking at things, that women are nurses, men shouldn't be nurses. I'm a nurse, okay. I started my education in business and accounting, and as a teacher as well. Now I'm a nurse. So for you that is out there, a guy that wants to be a nurse and have this kind of thoughts back in your mind that, oh, it's a lady's job, I'm telling you, when you get into the field, when you get into this job that we're talking about, then you will love it. So if you're out there and you're finishing high school or you're in college, you're doing your prayer courses and you're looking for something to do, if you're the kind of person that wants to help, that you want to show love to people out there, then nursing is for you. So I'm encouraging every one of you, the young ones that are coming up. And it's not just for the young ones. When I was in school, I was sitting in classroom with people that were like my dad's age. But education, you learn, there is no limit to being educated. You could be educated in any level you find yourself in. So for some of us, or those of you that are in the community that wants to be a nurse, okay, probably you'll be sitting there and you need somebody to encourage you, to give you a boost as to what to do and what not to do. Then I'm sitting there and I'm being a help or giving you an advice to step in and pursue what you need to pursue, and it's a good call.
Thank you very much, Mr. Philip Sami Conte. We also have here Sister Agatha Dembi, and the question I have again for you is, you have been giving out to the community. You have explained some of the things you have done for this community. Now my question is, how supportive has this community been to your endeavors?
First of all, I'm going to introduce myself. My name is Agatha Dembi, married to a very handsome man, Gerald Dembi, with 3 kids and 1 grandson. And I attended the School of Nursing in Sierra Leone, and presently I'm a registered nurse and working in the long-term care. In 2013, I proceeded doing my BSN, and I finished in 2014. And presently, I'm working in the long term, and I'm doing pediatric nursing too, which I love it. And I'm a treasurer in the MINA organization. And thank you for having me. Okay, coming back to the question you asked. First of all, we'll do healthcare assessment every 3 months, which we have people coming into the Light of Christ building, because we don't have nowhere to do it for now. We started doing it in the church, which we advertise, and most people come in. We check their blood sugar, blood pressure, and we divide ourselves into groups. We have some groups for blood pressure, blood sugar, weight, abdominal gait is measured. Then we have other people that give education to these people when we have like abnormal reading. So they will educate them what to do next. Sometimes they will educate about their diets, and exercise is very important in life. And they educate them again to see their doctor in certain readings. So people really always come when we have this quarterly assessment.
Right. So, what is this community that you are helping? How are they also giving their cooperation, their support?
Their cooperation is very, very outstanding. They really comes in a number of people, and we have a lot of people from different cities, North Brunswick, South Brunswick, Somerset, and most people comes like every 3 months. We have like permanent people that always come when we have this assessment fair.
So viewers, again, this is the Sierra Cast TV discussion program from Somerset, New Jersey. We have come to the end of our program. We have spoken to members of the MINA organization. You have heard about what they plan to go and do in Sierra Leone. And I must say that it's encouraging to see a group of Sierra Leoneans getting together to go and help their country. If every organization, if there are organizations in this country where people can have the same goals to go back and give to the community, our country will become highly developed. So instead of people just sitting down and complaining and waiting for the government to do everything for them, here are Sierra Leoneans who have decided to use their own resources to go and do something for their country. And as the First Lady of the Light of Christ, Mrs. Kumba Samura, who is seated on my left-hand side, she said that ask not what your country can do for you, but what you can do for your country. It's a very nice philosophy for Sierra Leoneans to inculcate. So we thank you very much, members of MINA, for coming. You have a very good plan for our country, and we hope that you're going to accomplish them. We pray that God will give you the opportunities that you are looking for, and that He will strengthen you to be able to accomplish what you're going to do. Thank you very much.
Thank you.
Thank you.
Okay.